Welcome, friends. We when feel that no COVID somewhat better than what we knew about it a few days back. Another variant comes. When we are planning how to go about it, how to contain it, how to mitigate it, there is another threat coming up. So in last 2 years, entire world has changed so much, and entire spectrum of threats, biological threats to human beings, have gone through such expansion that it is very difficult for common people to understand what needs to be done when we face biological threats. We also feel very, very weak, meek, and sort of helpless because we do not know what are the real threats and what are the threat protocols. And especially all these worries and the threats and vulnerabilities increase multifold when we happen to be health caregiver or protection professionals, security professionals, or health workers. So today we are going to discuss security industry biothreat protocols for Acturus variant and Black Fungus. You have already met before, and once again it is my privilege and pleasure to introduce the eminent speaker with us, and he is Mr. Shuan Christian. He is Director General of International Security Industry Organization since 2002. He is also author of very well acclaimed book called HIM Human Investigation Management, which is focused on standardization and capacity building for globalization, resulting in HIM MoU endorsed by CAPSI, Centralization for Private Security Industry, and SASA, Security Association of South Africa. Gentlemen, this discussion is brought to you by International Council for Industrial Security and Safety Management, which is in forefront in professionalizing the profession. And if you have already not subscribed to our channel, please do that. And whenever and wherever you feel during the discussion uh, any reasons to ask for explanation, raise the questions, make the comment, and be visible. Thank you very much. And over to you, Shuan. Again, like I said, when two friends meet, they are not enough pleasantries already to exchange. So it is nice to see you smiling and looking healthy. What are the biothreats and what are the protocols you suggest?
Thank you so much, Professor Tiagi. Before I answer the question, I'd like to acknowledge CAPSI, the Chairman Kunwa Vikram Singh, that's facilitated and brought in all the different organizations together with regards to tackling the biological threat security. So I would like to, obviously acknowledge him because he's a very important person on this mission, as besides yourself. Firstly, we've got some countries will have higher collateral damage than others because some countries have got multiple biological threats taking place at the same time. Now, the security practitioners, be it the academic or be it the practitioners on the ground, we all have to be totally aware of what type of protocols to utilize for a biological threat because we are the ones that are doing it on the ground. We're the ones that are working on the ground. And we deal with life impacting and deadly incidents. So we have to focus continuously on the actual job at hand. We take it very seriously. Now, the reason why different countries will suffer different levels of collateral damage is because of, firstly, micromyces, which is black fungus. And black fungus is a life-impacting or deadly situation. We have got many people that are infected in certain countries because it's not in each and every country. Only some countries have this particular strain, or let's call it strain of black fungus, where we have a high mortality rate of people having a 50% chance of dying. If they don't die, they either lose one eye, if the fungus enters one eye, both eyes, or the top jaw. So when you have got this particular virus that's running at parallel to Optus, then we have a major issue in certain countries. Not all, but in certain countries. The thing about Optus is that it is faster and fitter than the other COVID strains. Now, the problem is that when people get infected, obviously the immune system is compromised. Now, many scientists have stated the fact that when somebody's body is compromised and they're more susceptible to black fungus. So you've actually got a more deadly situation coming. So it's not only being concerned just about on the Omicron strain called Acturus, but it's also the black fungus that is just as worrisome because of the implications. So we do have multiple issues that are taking place. That is why we address and we understand it. You know, the security industry, we're the ones on the ground that actually have to really research the actual threat, the nature of the beast. Even if we talk to monkeypox or mpox, we understand that the major threat, because we researched the WHO research, and we realized or found that there was 1 in 4 children that was normally born. There was a normal healthy baby. 3 passed away, 3 died, 2 miscarriages and 1 fetal death. And this is what we do. We actually really understand what we need to deal with and contend with, because we deal with life impacting and deadly incidents. So we have to take this seriously. So when we actually have a look at this, we have a look at the technology that we use, because we take all the temperature. So we have to address thermal imaging cameras and thermometers, electronic thermometers. We also manage the flow and behavior of people, as well as ensure that they sanitize. But we do more because there's crime related to the threat. And this is where we can reduce the actual impact of the actual threat. For example, old oxygen tubes that are connected to industrial grade for oxygen tanks, industrial oxygen tanks. If people are selling old ones, the virus, this black fungus, it could be inside the actual tubes and the valves. That means you're getting a full dose of black fungus. Now, there's organized crime and gang crime that are actually selling bottles or actually refilling bottles. So you must know this is a deadly incident. So we have to be fully aware of all the implications. But at this moment in time, in certain countries, there are protocols that are written specifically for black fungus inside the actual free security protocol guide, which we'll give you the link to. That's a free pamphlet, or let's call it booklet, that contains all this information. Because all the security practitioners now must quickly, in certain countries, must look for this virus, this black virus, wherever it is in their ceilings, and get people to summon the right people to come and clean it. And also to ensure that this black virus is eradicated. If we can save one life, or one person's face with their eyes or their jaw, this is the job that we do. It's an important job. So you must keep in mind that these viruses, we have to know this information. With regards to Acturus, at this moment in time, it's got a spike protein, which means that it's actually traveling faster and stronger than any other virus that we've had, Omicron virus strain. Now, the thing is that we're finding out more about this information, but people also can have pink eye. There are reports of people getting red eye or pink eye. And you are aware that the eyes are just as porous as the mouth. This means that we have to wear eyeglasses or facial shields, especially if we're dealing with physical violence. We actually have to use all this extra PPE, the personal protection equipment. And we can't, if we're managing the flow of people and we're managing the behavior of people, we have certain protocols on how to actually do that. So when we're addressing the technology, when we're addressing the protocols, how to manage the flow, about the mythologies that we've got to use in calming people down, these are all protocols that we actually have to institute. And they're freely available on the actual booklet. Professor, do you have any questions?
Right now, in fact, I have a few questions which I noted down, but then I hope that these will be addressed a little later. You may continue in the meantime.
I can go further with elaborate with regards to the technology, and this is a very important aspect. When the technology initially ran onto the market, there were manufacturers that exaggerated the technology, the actual results. So we actually have to look at the various, we provide in the booklet various reference points that you can check, firstly, if the protocols are being followed. And second of all, the performance of the technology. And this is also of concern. Now, the reason why we actually have to keep in the loop with the technology is because now certain technologies have become banned to use in government sites. If you are unaware of this information, then you're going to end up with reputational damage. If you're the installer or provider or company that's actually using this technology in those or supplying services to any of those institutes, and they have good reason to do so. Now, that's one of the reference points. So these reference points are very important to pay attention to. Secondly, we're also utilizing technology to lower the risk, not only to assist us in managing the flow and the behavior of people, but to bring in the necessary manpower or workforce onto site to do what has to be done. And also to ensure that we can actually cut down the corruption, where we actually got supervisors in hospitals that are actually providing, selling oxygen bottles to the patients. Now, there's so many of this type of, so we have to have the analytics of the technology for, in other words, anti-tailgating, both in and out the building. So we've got all these technologies that we talk to. Not only is it on the actual biological threat security protocol, but it's also on the HIM tool where we talk to the technology and equipment to utilize at this moment in time. Or as a matter of fact, it's the new norm now, because we've learned so much from our experience with regards to COVID, that now we have a new norm, a new way of doing things, of understanding the technology and actually how to utilize artificial intelligence and how to get the most out of it. And we actually utilize this for biological threat security. Furthermore, we have to go into profit protection and getting the budget from the clients, because the clients are reluctant to give more money to the security companies to do the job. They've only maybe considered the budget because of COVID for just masking and sanitizer. This goes way beyond that. So at this moment in time, we have to deliver the right presentation to the end user, the person, the most responsible person, the company, the owner, whoever it is, that they must open up a contingency budget. In other words, they don't have to spend it, but they have to have a contingency budget for our protection wear, or for new thermal imaging cameras or electronic thermometers. In other words, they have to consider all these issues because it can eat the profits. We must keep in mind that this situation is not just for India. This is throughout the world. But there are even more countries that are suffering from black fungus in their countries, and so they're going to have more collateral damage. Therefore, they're going to lose more money. We have to understand all these different issues. So it's easier to actually go through the tool step by step, follow the process as prescribed. We've got free video clips that actually give an overview, as well as a booklet. However, keep in mind, the protocols used for housing, be it a hotel, an old age home, a ship, are totally different to the protocols that you would use if it is a mall or a shopping center or if it's a site outside. They're totally different. And there's reasons for that and good reasons for such. So pay attention to the actual link that you can be made that you can have available. You can either find it through CAPSI, where you'll find the ISIO on the homepage of CAPSI is the ISIO link that you can go through, and then through ISIO you can find HIM, or it could be on YouTube that we can actually put the link there for you so that you can actually access the free booklet as well as all the free video clips that can assist. We're here to make a difference. This is our job. We're bigger than any military unit in the world. We're the ones that find the crime and stop it, protect sites, and save lives. Thank you,
Yes.
Professor.
Joan, for the benefit of our viewers, in the description box, I have given the link of your website. So if they want to get more information on current subject and also on HIM, they can get the link and the detail through that link. About 2 years back, around the onset of Corona, there were big headlines in Indian newspapers about black fungus. And at that time, it was said that black fungus cannot be totally removed. And all the hospitals do have black fungus present, and whatever best they can do, it cannot be fully removed from the environment. And it has caused many deaths, not because of corona, but because of oxygen tubes. And you said very correctly that the hospital where they buy oxygen in bulk, industrial oxygen, and the tubing they have internal tubing already laid out. From that point to the patient, there is only one silicon unit which is put through mask for oxygen. That is the probably that is the only thing which is sanitized, fully sanitized, put in a sanitized box and used. But remaining entire oxygen delivery system remains vulnerable. So health givers, I'm sure, would pay more notice on this. But you have already given one additional PPE equipment part of your suggestion for health and safety and security personnel. Today, besides their gloves and mask and apron, they also essentially need to put spectacles or glasses. And what you say about the pink eye, around same time, June onwards in India, where it will be extreme hot conditions, conjunctivitis is known to spread. It is very highly infectious disease. So now we have handled conjunctivitis traditionally, and it approaches patient for 7 days to 15 days, and then with the repeated eye washes and certain medicines, it goes off so easily. But will it be lethal if it is in that combination? You talked about eyes being porous, and if that be so, then why there has not been any report that corona can affect the patient through eyes also? I have not heard any report about it.
Professor, as I elaborated earlier, we do meta research because this is our job function. And I gave the example of what we found out with regards to mpox. Now, where we've got specific protocols for that. But with regards to the eyes are just as porous as the mouth. The eyes are just as porous as the mouth. That's scientifically proven. If you ask any doctor, anybody, the eyes are just as porous as the mouth. And you've got airborne viruses, and you've got viral viruses. Now, conjunctivitis is a liquid. It's a viral transmission. So the liquid is highly infectious. It's the same with monkeypox pus of dead skin. It's still infectious. You can touch it. You touch your eyes. You know how many times people touch their eyes every day? Now, when we deal, the thing about the practitioners is that we deal with aggressive and violent people that are shouting. They're spraying out these small droplets. Those droplets can go in your eyes, not just only in your mouth. It's these are serious considerations. Now, the problem is that not many people might not die from COVID. There are many that do die. There are millions that die. One person dying is enough. I mean, it's a deadly disease. But when you compound it with a second threat, like mpox, and the problem with it is that organized crime and gang crime are the ones that are selling and dispensing oxygen and oxygen bottles and things like that. And yes, their eyes, if they go into hospital, into a hospital and they're sharing the mask, they can contract it. There's so many different problems with this thing that it can blow right out of proportion. You know, it only started with a few people in China and ended up hitting the whole world. And this is the type of, we understand this impact. There's so many things that can go wrong. That's why every single security practitioner, even if you're an academic or a pre-academic, you must know that the practitioners that you're writing or you're teaching or you're training on the ground deal with life-impacting and deadly incidents. So we actually have to do the job properly. And this is, and the world must acknowledge that we're the biggest force. People used to look down at security people and think we're just watchmen. This is not the case. We're the ones that are actually doing the job. Throughout the world, everybody learned from COVID. They had to go through security. Their temperature was taken. The flow of the people were managed. The behavior of the people were managed. And this is what we do. We're a vital component to limiting the level of collateral damage of a biological threat.
In fact, Jean, for that reason only, Indian government made security services as essential service, and today it makes very qualitative difference in approach by the establishment and also by the common people, because when government recognizes the type of service which is being done by the security personnel to the society, to the nation, considering the importance of their services rendered, then only country recognizes that service as essential service, without which country would be very adversely affected. So I'm happy to share that security personnel during this entire period of COVID, about 2 years plus, have performed exceptionally well. And previously, when they were treated as uh, people of limited utility, they became overnight multitask masters. They were working as safety people, they were working as health giver, they were, of course, at the side working as security personnel, essentially their job. They worked as fire personnel. So fire, safety, health became somehow their skill sets which they acquired during this period. And today, I am sure no management or no country would like them to again, go back to generalized category. So today, multitask masters, which this industry has prepared, the security personnel, uh, they themselves become very vulnerable. So one thing you mentioned, that beside conventional PPE, they must also have uh, protective eye covers or glasses.
Well,
Another
not
thing,
all. Well, sorry to interrupt you. Not all staff. It's the staff that are dealing with aggressive behavior, violent and aggressive behavior, and a methodology to actually calm it down or to stop that before it gets out of hand.
yeah, that also happened. There are visuals all over world, and mostly from China, where people waiting in queue, very long queues, and people were waiting for not only the medicine, they were waiting for food, they were waiting for transportation. Queues were huge and long, car traffic jams, and of course, when such thing happens of that scale, people tend to lose their calm and cool and control. So security personnel became all the more visible because their controlled and measured response. So their soft skills today are once again appreciated, and all private security industry must pay special attention that this is also a very important skill set for security personnel, that they must maintain their temperament and they must be trained to handle the agitated people. Because in such medical emergencies, getting agitated is human nature, and it can be only controlled when opposite party is in control of the situation, always keeping the temperament cool, and they behave very maturely and with sympathy. In fact, here apathy or any other word would not serve the purpose I want to convey. Sympathy is, that they stand beside them. Apathy is a little different here, but then you have very importantly pointed out that different skill sets are highlighted, which are essential in today's world for security personnel. Another point which came to my mind, and you may like to uh, put me wiser, beside oxygen, uh, COVID patients would be repeatedly nebulized. And there are small machines, nebulizers. They are also another potential threat, that someone is already suffering, and then that patient may suffer, beside corona, may suffer black fungus also.
Correct. The humidifiers. And so these are breathing assisted breathing machines. Now the thing is that sometimes people, when people are desperate, Maslow wrote in 1947, a psychologist, that we have basic needs of to live. Our needs are love, attention, acceptance. Those are our wants, and we need air, and we need security. These are the basic needs: love and attention, and these things. But the needs today, people they need asthma pumps, and they need medicines, and they need even bad things like drugs and alcohol. People are desperate. When you're denied any of these needs and wants that you desire, then people can break their moral code and go very extreme. So we're dealing with the basic needs of people to live and to survive. They will do anything. So it's created a situation where it's an issue for the patients as well as for the actual suppliers, because there's a lot of corruption involved. The more, when people are desperate, corruption comes in, and organized crime and these issues. That's why we do more than just deal with the actual disease. We actually deal with other things that are aligned to this. There's a hell of a lot that we're talking about. But at the end of the day, we've learned a lot over these years that's changed the way of security, the way we do things, and how we're managing things. And there's new technology available. So we've grown dramatically, and we actually must utilize the new norm. We have to change with the times. We can't say, yes, we did COVID, and we just did masks, and we just did that, and that worked. No, not this time around. This time around, we all got to hold hands together, as you said, and you commented on that particular article on LinkedIn, that we all have to work together.
Right. Thank you, Johan. In fact, that is the way both of us wanted to have a discussion proceed, because it is not a discussion of doctors or healthcare givers. It is discussion amongst two practicing security professionals. And for the benefit of security professionals, health and safety may be also a beneficiary of this discussion. And that's why we kept the discussion at that level, which is easy to understand. No technical jargon and medical long names and phrases are used here. I also would, beside what you have suggested, like to suggest to our audience, and that is typical Indian approach, where we very heavily and with long history have a strong belief in Ayurveda system. Those who are not connected with Indian approach to medicine, and especially Ayurveda. Ayurveda is science, part of our old treaties, part of our Vedas. And in Ayurveda, it is very clearly mentioned about the medicinal values of turmeric. So turmeric is known to boost the immunization. Turmeric, especially when used with the lukewarm milk during night, is supposed to boost, and it is research based. In fact, only 3 days back, I was attending a seminar of global level in Delhi, where medicinal values of turmeric were being discussed. And the point came here that lukewarm milk, a spoon of turmeric powder mixed and taken before sleep, after dinner, will increase multifold the body's immune system. So that may be, limited to Indian audience, because they can understand and appreciate this advice. Otherwise, you have already mentioned the protocols, and I'm very confident that discussion cannot be so enlightened and yet so easy to understand. For that, thank you very much. I feel that our viewers are immensely satisfied. Joan, thank you very much for sparing your valuable time, and I look forward to have another introduction of another professionally important subject. Till then, remain happy, remain healthy. Thank you very much.
Thank you, Professor. Take care.
Those who have not yet subscribed to our channel, kindly do so and remain tuned in.